Alzheimer's Longest Day. Just wanted to let everyone know that you are muted. If you do have a question, please type it into the question box, and at the end I will try to pick out at least some of the questions that seem to be asked for the group, so that we can do that. But again, everyone is on mute to give it a better listening experience. My name is Carla Sutter, and I am the Director of Operations for Synergy HomeCare. I am also a social worker who has worked in the home care field and the healthcare field for the last 25 years, working with families and clients whose lives have been impacted by age or illness. And really excited to be able to present this last seminar on advocating for ourselves in the healthcare field, because I think it is such a key one, not just for those families who are living with someone and providing the care and support for someone with Alzheimer's, but for each of us as a healthcare consumer. So this will be all about how to be your own healthcare advocate. And again, it is for those who are advocating for themselves as well as, or in addition to, somebody else. For those of you who have been on any of the other sessions today, I've shown this slide several times, and I think it's really just an important one for all of us, and particularly when we are in the healthcare realm. There's a lot of sense of being out of control for many reasons that we're going to talk about as we go through the session. And I think it's really important to think about things that we can control, things that we can influence, and things that we cannot control. And really, I think today's session is really about what we can influence. Oftentimes, we are faced with a diagnosis that we can't change, but we certainly have influence over not just how we're managing the symptoms and the treatments that we have chosen, but also how we are participating as part of the healthcare team and how we are choosing to manage with those in support of us as well. So I think I always like to start off with kind of definitions, and because today's session is all about advocacy, I think it's important to kind of look at what an advocate is. And it is one that pleads the cause of another, specifically one that pleads the cause of another before a tribunal or judicial court. And now that's a little bit different from what we're doing, certainly, but this is definitely pleading the cause of another in front of our healthcare providers. One that defends or maintains a cause or proposal, and one that supports or promotes the interest of another. And clearly, when we attend a appointment within the healthcare realm with somebody else, that is exactly what we are doing, and that is exactly the role that we should be taking, and feeling really proud about that. And advocacy, while it is for oftentimes talked about in terms of being for somebody else, I think the most important thing that we can also walk away from after today's session is that it is as important that we recognize that we have every right to be advocates for ourselves, even if we don't have somebody else speaking for us, and we are the ones speaking in our own behalf. To be an advocate for yourself within the home healthcare field, you've already accomplished the first step, which is, one, recognizing the importance of such an act, and two, getting and finding the resources that are going to help accomplish this in the best way. So congratulate yourself on this, again, as it is your first step. So why is this important to even think about, and why are we even having a conversation about advocacy? The most important is that it is the only way that we really can truly make informed decisions about our own health. And we need to be able to do that if we are going to have the best outcome. And if not you, then who would be the advocate for both yourself or for others? Research actually shows that the more that we advocate for our own health care, the better our health outcomes. and we're going to talk more about that. It's important because it is the only way that we can align what is happening with our treatment plan with our own personal goals. Because if we're not able to communicate what our goals are, then those providers are not able to understand those and be able to help with that. It allows us to have a clear and better communication with our providers. And while I think oftentimes we go into this thinking that they would rather not have us as a active participant or advocating for ourselves or others, in reality, the best physicians, the best healthcare providers want you as a active participant in your own care, because it really does aid them in knowing which direction to go. It is the only way that you're going to understand your treatment plan. It will protect your assets. And those assets, we're talking about financially, but it's also your time and your energy and your stress and all of that, your emotional well-being is what you're protecting by advocating for yourself. And it allows you to remain in as much control, or at least be an influencer on what some of the outcomes are going to be. So who are we advocating for? I mean, this could be one or all of these. Our first is certainly to ourselves. It may be for a family member, and it may be because that family member themselves don't feel comfortable, don't feel like they have the ability or the energy because of a diagnosis to take on that role. It may be because they have a diagnosis that limits their cognitive abilities or their memory to be able to manage that information. And it may be a friend as well who feels most comfortable having somebody with them as they explore this area. So it's a combination, and it also can be for a variety of reasons. It's important that we get comfortable with the idea of advocacy, because for many this is not an easy role. First off, because so many of us don't want to be a bother or cause anyone trouble. We feel that if we participate, if we have a voice, that we're kind of muddying the waters, we're making it more difficult, it takes more time. Others may believe that they don't have the skill set or the knowledge to even challenge or question a healthcare provider. And I think what's most important around this is that it really, your advocacy may be most in the form of just ensuring that your goals, what's important to you, is what is set forth to your healthcare providers. You may not be challenging them in any other way than ensuring that they know what is most important to you. And the other piece is that many believe that there is an innate power differential in the healthcare client relationship. And I think that has existed, and I think we've really, for the better, moved away from that. I think very few physicians and healthcare providers any longer feel that they have a complex of being better than, and that no one should question them. And honestly, I think the internet has done a lot on that realm, only because now information is available, and people at least have some better language, some better ways to kind of utilize the information that they're finding. And I think that's all for good. It is so important to step out and to use our voice, because so many of us, when we're in an environment, we don't say what we feel. We don't trust our instincts. And I think we often start this from an early age, and I think it's really important that we do trust our instincts. And again, oftentimes we may be feeling uncomfortable, not because of the present situation, but because of some past experiences that has translated. But for whatever reason, the present situation isn't making us feel any better. We have a couple of options. We can say, I'm uncomfortable and I believe it's because of X, Y, Z. what is it that you're able to do as my provider that could make me feel more comfortable, versus just kind of removing yourself, because you may find that you're never going to find somebody who's going to be able to help, but you do have to at least express why you may be feeling uncomfortable, and trying to see if that relationship can be saved. Communication is the key to good health. When people take an active role in their own care, research shows that they actually fare better. The ideal doctor-patient relationship is like a meeting of two experts. The doctor comes with medical expertise, and the patient enters with contextual knowledge. And this is from Dr. Paul Haydett, who's with Baylor College of Medicine. And I'll be sharing several other quotes from this organization, as well as a resource later on, because they really have focused their medical training and their practice at the College of Medicine on this patient doctor relationship and communication, that they recognize that the best patient is one that has a voice and is given the opportunity to share and to question. You say potato, I say potato, and in medical jargon, what we may hear is she was ingesting a combination of high-fat solids and exudates derived from a common bovine excretion. The communication that builds trust would be Little Miss Muffet and eating her curds and whey. And this is such a great example because, again, I think when we talk about medical jargon, I think there's very few physicians or healthcare providers that use it with ill intent. They don't mean to be as confusing as they are, but it comes out that way, and then we often feel like we don't want to say, I'm sorry, that made no sense to me, can you share? And instead we kind of nod our heads and keep going, but we've missed a huge piece of what we need to ensure that we're following the plan and understanding the treatment. And so we all, as healthcare providers, need to take the responsibility and be recognize our part in that. And clients and patients need to step up and call us on it when we are using language that confuses versus promotes.
And I do think so.
Our first step in all of this is making sure that we even choose the right doctor. I think we do absolutely have a greater opportunity now to see doctors out on the internet. We can see reviews of them. We can see articles that they may have written. We can get a sense of who they are. I think that can be wonderful. It can also be dangerous because, as many of us know, particularly around reviews, is that reviews are not always done for the right reasons, and they are sometimes with trying to get back at somebody for something that was not a slight to begin with. So we have to kind of think about how we're looking at that. But the first is really, is this a situation where you should be seeing a generalist or a specialist? And you know, it's sometimes hard to know which doctor you should be seeing, and it's very easy to go online and say and type in a query for, you know, who should I see for a broken bone, or who should I see for a muscle strain, or who should I see for concern about memory loss. And it will give you that indication because, again, there are so many specialists, and you know, we are not going to we are going to look for specialists in so many other areas. You know, we go to the if we're getting our hair cut in, and we're women, we tend to go to a hairstylist that is going to work with women's hair much more than us kind of going into a barber and going, well, I mean, he knows how to cut hair, he knows how to hold a scissor, but we're going to go to the person that has spent the most time with the kind of situation that we are needing. And that's the same with the specialist versus generalist. Yes, every generalist can provide and prescribe medication for depression or anxiety or any number of mental health diagnoses. However, I would never recommend having a generalist prescribe that if you have not already seen a psychiatrist who's going to help with the diagnosis and really have a much broader sense of all of the different medications that they're using. A generalist could certainly say you have high blood pressure, but if there's heart issues, I would absolutely want to be going and seeing a cardiologist who has a lot more knowledge about that. So a generalist is a great place to start, but then needs to and should be directing to those specialists who can really complete that process. You can ask for recommendations from other providers that you already trust. So if you have a good working relationship with another physician and you like the approach that that physician takes, then what a great opportunity to ask them for a recommendation for a specialist, because they're going to tend to work with providers who have a similar approach as they do. It is absolutely okay to change providers. I think we feel like once we have chosen somebody that we can never change and that we're going to hurt somebody's feelings. And in reality, very rarely will that physician even need to know that you're changing, because you're going to be sending, or they're going to be, the new physician will be sending a record request, and the physician probably won't even see that, as it will go to the information management team. And again, not every physician is probably the right fit for you. It may be around personality, it may be around style, it may be around approach and how much information they're willing to share. When I've had people in my life who are dealing with serious illnesses, for instance, cancers, I've made very clear to them the one thing that I can offer up the most is to ensure that their general physician is open to working with their oncologist, is open to working with whatever other physician, perhaps a plastic surgeon if they're needing to have a mastectomy, so that there's a good team connectedness. And if any one provider says, I really don't do that, you'll need to share that information back and forth, then that's probably not the right person for you, because it's really, the onus should not be on you to be sharing medical information. The benefit for you is to be able to have them talk among themselves, figure out the best options, and then have one of them presented to you. So really, again, I think we often become concerned about that. Some health insurances do certainly support and actually require the healthcare team approach, which would mean that you're choosing a healthcare team or a system, and everybody works together within that. That does help certainly with the aiding how records are transferred back and forth, and no access issues, and that it's easy enough to be able to get one record from another. For anyone who has worked within the Mayo health system, coming from Minnesota, very familiar with Mayo. And again, when you're in the Mayo system, no matter which department you go to, and it's a well orchestrated day if you're working up a diagnosis from one place to another, and your records just follow you throughout the system, no matter which office you end up in. And it really does help make things easier, and you're not responsible for kind of managing that. We need to let them help you. And a big part of that is that we participate in our care, and that we do ask questions. Now, these are questions that should be written down ahead of time. You want to be able to do it in a planful way, and you want to be able to make sure that it is not disjointed, but very important to be able to participate. Request to see results. If a test has been done and you haven't heard back, it is absolutely acceptable for you to call and say, I'd like to get my test results. If the information they share with you does not make sense, then absolutely ask to speak with, the nurse or the physician and get a call back so that they can explain it to you. It's the same idea when you go to a pharmacy that they always ask if you'd like to consult with the pharmacist, and I think that's a great way to build communication with your pharmacist and have a better relationship, is that they do now have that consult. They want to know, do you understand how to take this medication? Do you want to know how to, are there side effects that you should take note of? If you feel like you need more time during an appointment, absolutely prior to when you're making the appointment, please let them know. Let them know and see if that is going to be workable. But don't get an appointment, show up, and then ask to get extra time because, again, they've scheduled it in such a way for a certain period of time. So you're always going to want to let them know prior. Take notes so that you can refer back to them, and this is sometimes why it's so beneficial to have someone with you so that they can be taking notes while you're trying to ingest the information. Educate yourself on what may be happening, but don't spend so much time Googling and going on WebMD that you are convinced that you now have the most bizarre case in medical history versus a very simple diagnosis that they're going to be able to treat. And speak up. If you don't understand something, if it doesn't make sense, if you need more information, absolutely ask the question. In participating in your care, you want to provide a complete medical history. Don't leave information out because you don't think it's important. You can ask if that would be beneficial for them to know before you start documenting it all. But if they want a complete medical history, share with them your complete medical history. When they need a list of your medications, don't just include those that are prescription meds, but herbal and over-the-counter medications play a huge part in what they may or may not prescribe. It also allows them to know if from going from your over-the-counter medication, if they need to be giving you a prescription form. So many people take a lot of over-the-counter pain relief, for instance. If they know that you're taking over-the-counter pain medication regularly throughout the day and daily, they probably would be looking then at what they could give you at a prescription level so that you're not having to take so much of an over-the-counter, which could create other symptoms and side effects. And review any questions about your plan of care. Again, ask questions. Know why your provider is suggesting a test or procedure. And if you don't feel that you're going to treat anything based on what the test or procedure is going to find, then talk to them about that as well. Oftentimes when people are in advanced stages of a diagnosis, for instance, a cancer diagnosis, and the physician keeps ordering scans and tests and things, if the person is not going to change their treatment, if the person has now decided hospice, having those test results is not going to change the way they're managing their disease and may not be necessary to have to undergo. And keep asking until you understand. And if you really are still having a struggle with understanding because of the way that the provider is communicating, ask if someone else could explain it to you. That, again, oftentimes it's just a matter of approach in how somebody is sharing information. Again, ensure that results are shared and understood, and request time. When we take notes, it's important to, again, write down questions, concerns, and issues prior to the appointment. Bring that in. Number them as to what's the most important. Do not start with, I have a little bit of a headache, once every 3 months, when the chest pain that you're having is every day. So make sure that you're prioritizing, because at some point there's only so much that the doctor can review at any one appointment. One of the things that I think happens a lot is what we would call a doorknob conversation. Again, the physician has spent his time with you or her time with you. They're ready to leave. They get to the doorknob, and all of a sudden you say, oh, did I mention that, again, I'm having chest pains, or that I fainted for the last 3 days? That is not the time to, again, bring up the biggest priority issue when they're needing to move on to the next client. No realistic expectations of your recovery, and that's a question you can ask. Let the physician know that you want to be, if you do, you want to be told very clearly what is the expectation, what is success. Share your understanding of successful treatment and with your healthcare team. This comes up a lot when we're talking about when people are making a decision about whether they want to be resuscitated if their heart were to stop. And what often is the conversation needs to go is, what is successful CPR to you? Is it just the getting the beat back, or is it returning your life to the same level of functioning? Or is there, yes, I understand that I may be in the hospital for a little bit of time, I may have to go to rehab, but I hope to be able to have some, functioning ability. Those are important to understand in any treatment plan, because it is going to allow the physician to have a realistic conversation with you about what can and can't happen based on your particular situation. Speak up. Know what is happening and why, and you have the right to slow things down and get an explanation. To say, wow, that's a lot to digest. I need to have that reviewed with me again. Or I need to, go back home and have some thought about this, and then come back to decide what is my next step. There is absolutely a money and health connection. If finances are a big concern, and your finances are driving healthcare decisions, it's very important for you to be honest about your financial situation and to ask for help and look at resources available. There are many different programs that are available, particularly around prescriptions, that your healthcare team can assist you with. If you have a medication that you're prescribed and you end up not using it in the way that it is prescribed because you're trying to make the 30-day prescription last for 45 days or more because you can't afford to get it every 30 days, and then that you go back to the doctor but don't tell him that, and he's questioning why you're still having the same symptoms, it's important for them to understand that you're having the same symptoms because you may not be using the medication in the way it was really prescribed. And that happens. It happens very frequently, and there is no shame in being able to say, I financially am having some troubles, and I need to make clear decisions not only about my health, but how I'm going to fund this. Research shows that more than 4 in 10 respondents don't understand basic health insurance terms, and even fewer could calculate how much would be owed under different healthcare situations. So again, finances absolutely play a part, because we really have to educate ourselves or ask the right questions of people that do have that knowledge to understand what is covered, what is not, and what are options for the parts that are not. Physicians rarely understand individual health insurance policies, and their focus is not on what is covered, but it is on what is the best treatment. It is then up to you, your family, those around you to discuss what is then going to be covered and not. But that is why it's so key to understand your insurance, because a physician may suggest something that in the end, it's a great treatment option, but it is not going to be a covered item. It's one thing to then, when a physician provides you with a new prescription, to ask if a generic is available, if they can write that on the script. Most pharmacies cannot give a generic unless it is written on the script that it can be a generic form. And again, there can be a very large differential between what a kind of top-line prescription, kind of named prescription is, and a generic form. Not all prescriptions have generics available, and often there's a lag period of time before generic form will come out, because there are patents on formulas, and they have a certain amount of time before they run out, and then generics can be put into place. But I always ask my physician when he's prescribing is there a generic form, and if so, can you please write that on the prescription? And then once I get to the pharmacy, I make a decision based on what the coverage costs are. It's important for you to monitor your own medical bills or those around you for errors. It's estimated that 8 in 10 medical bills contain some form of an error. If a claim is denied or not covered at the level anticipated, it could be due to inadequate documentation or coding errors. So do ask those questions. Don't just pay and go, oh, wow, I thought it was going to be covered. You may want to go back and confirm that the right coding was done. Coding is that for every diagnosis, for every type of physical diagnosis, symptom, etc., there is a code, and everything is based on what that code is and then what the coverage would be. You can absolutely call your insurance company and find out, was there something that this should have been coded differently? Is that the problem? And request a detailed itemized bill of your charges from the provider so you know exactly how they were billing and what they were putting as the code. Keep records and always follow up. Include who are you speaking to, what's the day, what's their name, what phone number had you called, all of that. Ask for email confirmation for anything that's being told to you. Getting a second opinion. It's always recommended to get a second opinion, particularly around any life-changing or advanced illness. This is not the time to worry about egos and hurt feelings. It is very recognized in the healthcare industry that people are going to get a second opinion to make sure that everybody has a different approach, and this is why specialists are so key, because different specialists are going to approach a diagnosis differently based on what they know the best. That's why it's important to really look at the specialist and what the diagnosis is and who should be making that right decision. There are a lot of resources available to the community in terms of medical information. You can easily go online and Google questions to ask a physician about heart disease, questions to ask a physician when I've been newly diagnosed with COPD. Absolutely, look at those, print them out, get a good understanding of which of those questions do you already feel confident about and that you have answers to, and which are there areas that you may not be as familiar with. Again, utilizing the internet when it comes to advocacy around our healthcare is a powerful tool. I think what happens is if we try to replace the providers with the information we're gathering from the internet, because again, the internet is not selective. They don't understand pre-existing conditions. They don't understand your way and how you may be reacting to certain medications, certain treatments. They may not understand the allergies that you have to certain prescriptions, which would eliminate you from being able to go down a certain road of treatment options. So very key to kind of recognize the place that the internet can play in terms of your medical kind of care, but don't replace your physician. The other thing that people often, I think, get too comfortable with is relying on their friends and neighbors and coworkers for their medical treatment, and basing what they're going to do based on what somebody else may have done. And you don't often, very rarely, does that other person have all the information about your particular situation, nor do you of them. And so we tend to, again, in the right reasons, we're trying to be helpful, but it's really not beneficial to assume that your neighbor's situation, even if they have the same exact diagnosis of, heart disease or COPD or even dementia, and then be able to just do exactly what treatment plan they've done. Again, many different reasons why different treatment plans are offered for different reasons. So again, these are beneficial to be able to, it's a good starting place to maybe talk with friends about who they recommend as physicians, but it does not have to be your end. The same with the internet. And be cautious, particularly when you are newly diagnosed with something, particularly something that can have life-changing consequences based on the diagnosis to start Googling all of it, because we tend to, what they're going to show on some of these sites is going to be the most serious of any form of what we're looking at, and we may be at a very different place. And I will say that I myself have fallen prey to that, because you hear something and you just want to get a little bit more information, and you start searching, and by the end you've pretty much started to give away your items, because based on what the internet says, there's no hope, and in reality, what you have or what you think you have could be at a very different level than what the med doctor online is alluding to. There's several resources. Certainly, we at synergyhomecare.com, we have local offices that can help with any type of healthcare appointments and coordination. One of the key factors, and one of the things we're seeing, particularly with seniors or those with chronic and progressive illnesses, is that managing all of the healthcare appointments becomes so overwhelming that people end up not showing up or keeping appointments, and then they are missing opportunities for treatment. And so utilizing an organization that has caregivers that can not only drive somebody to an appointment safely, but can be with them during the appointment, can be a scribe who can then bring back that information to the other parties involved and family, but on the way home can stop at the pharmacy, pick up supplies, pick up the things that are necessary, which often when you're sitting in the doctor's office and you're overwhelmed and maybe you have some of your own cognitive decline themselves, you may not remember the things you need to pick up, and you get home and now you've kind of lost several days of treating something. The other is looking at geriatric care managers who can provide some care coordination. They can also assist with medical billing and help with kind of ensuring that you can manage and keep track of all of your medical billing, looking at the bills for potential errors, etc. And private physicians. Concierge doctors, or otherwise known as private physicians, are kind of a old but new kind of group. We've had those doctors who made house calls, and that's been replaced now, but we're kind of coming back into that. And concierge docs are physicians that actually, for a fee, usually you pay a yearly fee, and it gives you access to the physician in a different way than you would otherwise have. They often give you their cell phone number. You can have much more time during your visit with them. Some of these concierge docs just have a one-time upfront additional fee. Others do not take health insurance or Medicare, and it is strictly private pay. So it's something that you have to determine for your own self and family if it is feasible to kind of explore that level of medicine. But it certainly can give us back a year of a physician that's going to work with you and your family in a very different way. So that is one of the areas. The other areas you can also work with, there are private medical billing consultants that if you do have some medical billing issues, you can absolutely connect with these organizations. You'll be paying privately for their consultation. They're specialists in coding and insurance, so that they're able to kind of pick up on some of those things that we ourselves may not be as familiar with if you're not doing that on a daily basis. If anyone has any questions about this topic, anything that we've talked about or that I did not mention but you had a question about in terms of advocating for yourself, please feel free to type that right now into your question box, and I would love to be able to answer that. As someone may be writing, I will share again that Synergy Home Care has been so pleased to be able to participate in the longest day in this way, which has been to host 4 unique 1-hour seminars on topics related to health and aging, and with a special focus for the Alzheimer's diagnosis and caring for those with either Alzheimer's, dementia, or another chronic or progressive illness. And it has been our pleasure to be able to offer these. If you have additional questions, if you have a question that you would prefer to ask individually, please feel free to email me at the email that you see on the screen, which is Carla Sutter at synergyhomecare.com, or go to our website, where you can also download at synergyhomecare.com. You can download a free guide called Where Do We Begin? A Guide to Elder Caregiving, and that's going to give you lots of information about where to begin if you're providing care for an older adult. It gives you lots of forms and tools, assessment tools, as well as a glossary that will give you a lot more working knowledge of some medical jargon that you can feel most comfortable with when you're out at your appointment. I do not see any questions in the box, so I am going to assume that either everything was answered or you are just already online starting to search or download your free Where Do We Begin guide at synergyhomecare.com. But again, feel free to reach out, and thank you again for participating in this last session of our longest day. And if you have been with us all day for all 4, congratulations and thank you so much. And you deserve a huge pat on the back, and again, a big thank you. And you are now a specialist and an expert. So again, thank you so much for participating.